Thursday marks 2 years since the first case of COVID-19 was reported in the U.S. The virus has infected more than 69 million Americans and killed nearly 860,000, more than any other country in the world. And the Omicron variant is still spreading across the nation. Infected patients are pushing hospitals beyond capacity in many states. Bradley Blackburn has more.
I have no clue it would be like this.
Pamela Maples didn't get vaccinated because she thought it was worse than getting COVID. Now she's one of the 286 COVID patients at St. Luke's Hospital of Kansas City. Only 15 are vaccinated.
It's really profound sadness because we have the saddest stories you've ever heard in your life.
COVID cases are surging across the U.S. The CDC reports an average of 1 in 4 tests is coming back positive. A new study based on COVID cases in New York and California last summer and fall compared protection from vaccination versus prior infection. The CDC found people who were both vaccinated and had survived COVID had the most protection. Unvaccinated people with a past infection were a close second. By the fall, when Delta was widespread but boosters weren't, the unvaccinated who had a prior infection had a lower case rate than vaccinated people who had never had COVID. Health officials are also reinforcing CDC guidance about the importance of wearing the best type of mask to protect yourself.
High filtration masks, including N95 respirators, KN95, and KF94, provide better protection than cloth masks or even surgical masks.
But wearing any kind of mask at all is still controversial in some areas. The subject brought fierce debate to a school board meeting in Roanoke County, Virginia.
Masks do nothing for us. We still have to quarantine and students are still getting sick. The vaccinated and unvaccinated all alike.
She doesn't have any trouble wearing it. It doesn't bother her.
Earlier this week, Virginia's governor made it optional for students in public schools to mask indoors, but some districts decided they won't change their mask-wearing policies. Bradley Blackburn, CBS News, New York.
For a deeper dive, I want to bring in Dr. Anand Swaminathan. He's an emergency medicine physician at St. Joseph's University Medical Center in New Jersey. Dr. Swaminathan, always a pleasure to have you on the show. Last time you and I spoke, it was exactly 2 weeks ago, and at that point your state reported its highest number of COVID deaths in nearly a year and was reporting an alarming number of new infections. I'm wondering, have things started to get any better?
We're starting to see the turn right now. We're about 7 days of declining case rates. But Lana, one thing to remember is that we are still at about 15, 16,000 cases per day. That's much higher than the levels that we were in last winter. So while we are declining, we're heading in the right direction, we're not out of the woods yet. We need to continue that decline and see how things go. We still reported almost 100 deaths in the state in the last day. And this Omicron virus is just starting to surge in many parts of the country. We're still seeing about 2,000 deaths per day in the U.S. So while New Jersey seems to be turning around, the country is still really in the middle of this.
I want to ask you about the conflict between these hospitals being pushed to the very brink of capacity and new mandates saying, in the case of New Jersey, Governor Phil Murphy there signing an order just on Wednesday requiring all New Jersey healthcare workers to be fully vaccinated and boosted in order to keep their jobs. What do you make of that decision? And separate from the intellectual and perhaps what is right of it, is it having an impact in hospitals and providing care as many places continue to surge?
Well, we've seen how mandates can obviously help to get people vaccinated. And in terms of healthcare workers, you see very low rates of people who refuse to get vaccinated when that mandate comes into place. So I'm very happy that the governor has put this into place and is pushing forward with it. It's the right thing to have our staff protect our patients and have staff protect each other. One thing we don't really get a good handle on is we might see 1% or 2% of healthcare workers decide, I'm not going to get vaccinated, so I'm leaving the job. But what we can't take into account is how many unvaccinated healthcare workers would infect other healthcare workers that would then miss time or even get severely ill.
Sure. A very good point on that one. I also want to ask you about wastewater. That's something that, people don't normally talk about, but it is in the news right now because of this new CDC report that found that Omicron was actually detected here in New York City's wastewater more than a week before the first case of the new variant was actually detected in the U.S. Tell our viewers more about wastewater and how it serves as a kind of early warning signal. And given that, what is telling us now about the trajectory of Omicron?
Wastewater is one way that we can figure out when a surge is coming and also when that surge is starting to dissipate. And that science is really important to do. In order to detect this, it means that we have to have a lot of investment in these kind of public health infrastructures to do this kind of monitoring, which the U.S. notoriously does not have. We do not have a ton of investment in this kind of surveillance that we really need. What we have learned by knowing that this case, that there was probably Omicron in the wastewater at least a week in advance, means that our travel bans were worthless. They were useless. Even if they were good travel bans, which they were not, they wouldn't have actually helped. And that's what we see time and time again, is that by the time you're ready to institute a travel ban where you're detecting patients with Omicron or whatever variant, it's already in the population. And so those kind of measures don't really help. They do create a lot of problems. This particular travel ban, for instance, was clearly had a racial bias to it. That's a problem. So we need to understand how this influences or affects the way that we react in the future.
It's so interesting to see the areas, too, in which the viral load in wastewater is going down, and then other places across the country where we see that it could be surging. Some U.S. states are easing requirements for substitute teachers in order to avoid closing schools because of the virus. You and I have talked at length about schools. What's your latest guidance in terms of how to keep our schools and teachers and kids all safe right now?
I think the best way to keep our schools open, to keep teachers healthy and be able to provide that level of learning is to have multi-layered systems. So masking indoors absolutely 100% has to be there. Vaccine rates as high as possible. Lana, I think we are at the point where we need to start thinking about vaccine mandates for kids to attend school. We know that these vaccines are safe. We know they're effective. It is time for us to move forward, institute those mandates to protect kids, also to protect the teachers that are there. So masking, that layering of vaccines, and then ventilation. We need a huge investment of money to update the ventilation systems in public schools, which are sorely inadequate. We need to do these different layers if we're going to protect our students and our teachers, and not just from this pandemic, but from future infectious agents that could be coming down the line.
Always a good reminder that what we're facing right now is not necessarily what we're going to be facing in the future. One last question before I let you go. When we're talking about protecting the youngest among us, is there any more guidance about when we might be able to expect a vaccine for the 5 and under crowd?
Dr. Fauci seems pretty hopeful that we're going to see more guidance on this in the next couple of weeks. And I'm going to leave my faith in Dr. Fauci. I hope that he is right. I don't have kids under 5, but I have lots of friends with kids under 5 who are really anticipating these vaccines to give them that extra layer of protection. So I'm hoping that we are going to see further guidance on that coming in the next couple of weeks so we can start rushing to get those kids vaccinated. But in the meantime, we have to remember that only 25% of kids between 5 and 11 are vaccinated. So for parents out there, let's get all of those kids vaccinated too. And then when it's available for the under 5, let's push that group to get as high a vaccine rate as we possibly can.
All right. Dr. Anand Swaminathan, thank you for joining. Thank you for all that you do.